All right. So I normally do this in a restaurant and feed you, so that's my way to keep people like happy. So I don't know, no food today? Might be in trouble. All right.
We're all fasting.
Oh, that's right, actually. Yeah, that's good. If I would have fed you guys, you'd yell at me. What are you doing? Breaking their fast. All right, so my name is Nate. If you have a cell phone, if you could silence it, that would be amazing. Just a couple weeks ago, I asked everybody to silence their cell phone, and mine went off, so lesson learned. If you have questions throughout, you could actually raise your hand, ask them anytime, and if I feel like answering them, I will. Otherwise, I'll tell you to wait till later. But if you have a really personal question, like you guys all heard of HIPAA before, privacy. So if it's something super personal to you, I might just ask you to hang back for a couple minutes after. We'll address it one-on-one. We'll have some surveys that'll come around at the end too. And but yeah, if you have a question, raise your hand. I'll do my best to answer it generally so that it applies to everybody. Okay? Anyone in here really, first to start off, have any aches and pains? Oh, everybody just about. All right, well that's pretty normal. I do these just about every week, probably 46 to 48 weeks out of the year. So the common theme for most people that come to these seminars is they have aches and pains. So we're gonna talk about how to address the root cause of your issue and how to get you off of what we call the wheel of healthcare, right? Because if you raised your hand that you got some aches and pains, you've probably been dealing with it for a long time. It didn't just show up today. Right? You've went to your doctor, and here we are, we're still sitting here today in pain, okay? So we're gonna talk about stem cell therapy and how that can actually address the root cause, get you off the wheel of healthcare, okay? Make sense? Yes, sir. All right, here we go. So this is our agenda for my company's name is Neoform Wellness. I'm one of the co-founders of Neoform Wellness. So we're gonna talk about who we are as a company. We'll talk about what is pain, so everybody that raised their hand, your pain's a little bit different, right? Depending on what's going on for you and what you're dealing with. Pain management and why you are in pain. What is umbilical cord stem cell therapy? So we are the biggest, fastest growing white glove service company in the US when it comes to umbilical cord stem cell therapy. So we'll talk more about what white glove service means here in a little bit. Who and why people are using umbilical cord stem cells, and then how these umbilical cord stem cells specifically can help you to get out of pain, off the wheel of healthcare. So this is a little bit more about our company. We're a nationwide company. We're currently in 16 states, hope to be in about 30 by the end of the year. Our headquarters and our lab is in Lehi, Utah. You guys ever heard of Salt Lake City, or is anyone familiar with Salt Lake City? Yep, so Kyle actually came to our lab, and it's state of the art, to say the least. It's pretty impressive facility. But I like to spend a little time and talk about our lab, the owner of our lab, and our product. Because the product is the most important part when you're receiving umbilical cord stem cells, that you get the best quality product you can to help you get out of pain. So the owner of our lab, his name is Haven McCall. He's probably one of the most salt of the earth guys you'll ever meet. He's just a great guy, but he's got 25 years of experience in the stem cell industry. He's opened and owned 3 different labs at this point. There's probably a handful of people in the world that can say they have that much experience when it comes to stem cell therapy. So one of the best. You guys all heard of Johns Hopkins University or hospital? Yeah. He's a lecturer for Johns Hopkins. He has been for over 10 years. They don't just let anyone lecture at Johns Hopkins. They're not letting me lecture at Johns Hopkins, for sure. The product, or the tissue, right, umbilical cord, that is, the hospital where we get that is just over a mile from the lab. So why that is so important, the longer it takes to process the tissue, the less viable or effective it is. So what that means, our viability rate is 97%. That means 97% of the cells that you receive from Neoform Wellness are living cells. And all of our tissue, all of our product is third-party tested, not tested by us, but by another party, okay? I've seen third-party tests from other labs as low as 8 to 25% viability. So, and a lot of times they're telling you it's 90 or 94%, and it's actually 8 to 25. So that's where there can be such a difference in this industry on the actual product that you're receiving. So you want to receive the highest viability rate you can so that you can get the biggest or best results. So because our lab is just over a mile from the hospital, it's the Common Spirit Holy Cross Hospital in Lehi, Utah, our tissue gets processed in a couple of hours. That's why the viability rate's so high. A lot of labs will get the tissue from a hospital. They'll have to freeze that cord because they have to ship it across the country to the labs that's going to process it. Well, then they got to thaw it out and then process it. That takes anywhere between 1 to 3 days on average for most labs to get it. So that's why there's such a big difference in viability rates, okay? So we have what we believe is the best product out here in the country, which is extremely important. So 16 states, we educate over 1,000 people a month. We probably need to redo that. There's 20 of me in our company in the 16 states doing these types of educational dinners, or not dinners, seminars tonight, every single week. And we have about 40 to 60 people come to our dinners every week per person that does these dinners. So times that by 4, by 20, it's well over 1,000 people, okay? Seminars like this used to be given by doctors. We got any doctors in here? No? We usually have some doctors come because they're just not trained in stem cell therapy, so they're just like everybody else. They don't know and they want to learn more. But doctors are smarter than me. I used to be a kickball teacher like Kyle in a past life, and I was an officer in the Army, so I'm a pretty simple guy. Doctors, they use big words, goes over my head. So the more complex things go, the harder it is to understand how and why I can help you. So my job is just to keep this as simple and easy to understand and how and why it can get you out of pain, okay? Make sense? So we're going to condense the last 30 years of regenerative medicine research, over 5,000 case studies, and again, simple and easy to understand. In the next 45 to 60 minutes, we'll do a little question and answer at the end as well. It's our website, neoformwellness.com. And this is the reason that I do what I do. So that's my grandmother. That was her 90th birthday party, May of 2024. So it's been a little bit now. She's 91 now, but when she was 85, she had severe osteoarthritis in her hips. You guys ever heard of that? Do you guys know what that is? It's powerful inflammation. And they say that about 2/3 of people over the age of 55, their pain is reported from arthritis and inflammation. So it's just a really common issue for people as they get older. She also had bone on bone in her right knee. You guys heard of bone on bone before? Yep. It's the wearing down of the cushioning system in our joints, very common for people in their knees. But she was 85. The doctor did not want to do surgery on my grandmother. Any ideas why? What? Say that again?
Just medical risk.
Yeah, well, essentially she was too old, and they were worried she wouldn't come out of the surgery better than she went into it because of, could be anesthesia and a bunch of other reasons. But they were just worried she wouldn't come out of that surgery better than when she went in it. So surgery really wasn't an option for her. It was kind of taken off the table. She was using a cane for a lot, just mobility and stability to get around. She loves to travel, and all of the pain and the bone on bone and not having the ability or the option to get a replaced joint just really limited what she could do. It also really limited her, or it really affected her mood. She was in so much pain. She was taking a bunch of painkillers, okay? Has anyone taken a pain pill in here before? Do pain pills solve a problem? No, they just kind of mask and manage it, and for some better than others. If you run out of pain pills, do you stop taking them? No, you just refill your prescription, right? Do they have side effects? Horrific side effects. You guys ever watched a drug commercial before? What do they do at the end? They talk about all the horrible possible side effects, like potentially death, right? Organ failure, right? They're not good for us. So my grandmother, she received an invitation in the mail, because that's typically how we do these dinners. We send invites to people to come have a dinner and learn about stem cell therapy and how it can help them get out of pain. And so when she attended a seminar like this, she moved forward with stem cell therapy. She was really kind of out of options. And I got to see my grandmother over about 11.5-month period get out of pain and really get her life back. She got the full regeneration of the tissue in her joint, and it took her about 11.5 months. So on average, most of our patients see the regeneration within the first 6 months, and about the other 40% will see that regeneration anywhere between 6 months and 12 months. So we tell everybody, be patient and give that tissue at least 12 months to fully regenerate. So you think about, for my grandmother, it probably took her 20, 30 years to really get to the point where it was so severe. And so if it took her that long to create that problem, was it worth it for her to wait almost 12 months? Absolutely. I mean, like I said, the surgery really wasn't even an option for her. So my grandmother got her life back because of this stem cell therapy, and I really got my grandmother back. And so that's why I got into this industry eventually. And I just want to help more people similar to my grandma to change their life, get their life back, and get their quality of life back. So this is a short little video. Everybody likes a movie, right? So this is a short little video. This is in Chicago. It's they're highlighting a 76-year-old that had osteoarthritis in one of his knees. And he was really limited to what he could do because of all the pain that he was in. So they're going to mention amnion fluid. This video is back in 2018. It wasn't until 2016 that this became available in the States. Again, over 30 years worldwide. US is usually a little slower than everywhere else to get this type of therapies. And so when they say amnion, you're going to know that they're talking about stem cells, because amnion fluid's part of the birthing tissue, just like the umbilical cord and the placenta. All of that is chock full of millions of what we call day zero stem cells, because our stem cells are never younger and healthier than when we're first born. So when they say amnion, you just know that they're talking about umbilical cord or stem cells.
He's in the womb, and now there's a new use for amniotic fluid.
Yeah, doctors at Midwest Orthopedic at Rush are using that to alleviate knee pain in patients with osteoarthritis. NBC5's Lauren Petty shows us how it works.
Watching 76-year-old Marty Ciselzik balance on one leg, it's hard to believe he used to suffer from debilitating knee pain.
I couldn't even put a sock on. I couldn't put my pants on. I couldn't walk upstairs.
The retired firefighter loved to ski and run until he was diagnosed with osteoarthritis in his right knee.
Once that thing blew up on me, it was devastating, because that's what I really like to do was run.
So the whole kneecap has shifted over a little bit. Any pain or anything?
Marty went to see Dr. Adam Yankee at Midwest Orthopedics at Rush, who suggested Marty participate in a study involving an injection of amniotic fluid.
And it comes from healthy elective C-sections. And so this comes from mothers that are willing to donate this tissue.
Just as the amniotic fluid and membrane protect a baby in utero,
Same idea that you would want to have that happen in the joint.
I didn't care what it was. It could have been Campbell's soup. If my knee was going to feel better, that's what I wanted.
after one shot, Marty was back running again, even giving Dr. Yankee the first place medal he won in a 5K race.
So far, Midwest Orthopedics has used the shot to treat knee pain, but that could expand to other joints in the future.
And there's actually a trial that's starting for hip arthritis as well.
It's been 3 years since Marty's shot.
Been golfing, skiing, and back to just doing normal stuff.
Even running 3 to 4 miles a couple of days a week.
That injection helped me. I don't know if it'll help everybody, but it certainly helped me.
At Midwest Orthopedics at Rush, Lauren Petty, NBC5 News.
Yeah, like a lot of
great.
Yeah,
Yeah.
good to see.
It was not Campbell's soup. Stem cells. Okay, so Marty talks about getting back to golfing, skiing, running more often, pain-free. So we'll just come around a little bit. We'll make you guys interact. You guys didn't know you're gonna have to participate, did you? All right, so what is one activity that you would like to get back to doing more of pain-free, right? So if you did raise your hand, you have some aches and pains, think of the last time you were actually pain-free, right? For some of you, maybe it's not that long ago. For others, it's been quite a long time, right? So what's one activity that you'd like to do more of pain-free? Just a simple daily activity. You got Any pains? Walking. All right. You got anything?
I have more of a bone issue than that causes my
Okay.
pain.
Stem cells helps with bones, but what's one activity you enjoy doing?
Running like further.
Okay. You got any?
Running.
Running. Basketball. One more. How about you? Sleep? Yeah, absolutely. Yeah, I appreciate that. I'm going to come around a couple more times, all right? Fair warning, okay? Just so you guys know. All right, so White Glove Service, biggest, fastest growing white glove service company in the US when it comes to umbilical cord stem cells. So what that means is we're a full in-home medical concierge company. So our nurse practitioners that do the therapies, they come to your house to do the treatments. We don't have big clinics everywhere. You ever been to a big, shiny, multi-million-dollar hospital? It costs a lot of money to staff, to maintain, right? And who pays for that? Us. The patient does, right? Yeah, absolutely. So there's a lot of overhead with that. We don't have big clinics. We come right to our patient's home. So we'll send one nurse practitioner to an area, and they'll treat a large group of patients in a 1 to 2 day time frame. It'd be way more expensive if we had to send them on individual trips on different days. So we pass that savings that we save from not having clinics everywhere and being able to just take one trip to go to your home to do that. Okay, that's the first part. Yes, question.
So then if this is like a on-point service, are the nurse practitioners doing this under ultrasound guidance?
They have the ability to, but there's really not a need for it because it's intramuscular and it's a very uninvasive procedure. They have ultrasound available. I would say 90% of the time they don't ever have the need to do that. So
So it's intramuscular, it's not, I'm sorry to, it's not injected into.
yeah, I'm going to get into, no, it isn't into joint spaces. I'll get into the way that we apply, but it is into joints. Like when I got my knee, it went like right here. He had his done, no ultrasound. He had 2 knees, a hip, a shoulder, and an IV all within about 30 minutes. Back is not into the spine. It's into the muscles along the spine. This does not need to be pinpoint because these stem cells, once they go into your body, just like from the day you're born, your body has known to where to send your stem cells, right? They're chemical signals sent from your body to alert them where they need to go, okay? So your stem cells know, so that's why I say it doesn't have to be pinpoint. So if someone has low back, which is a very common issue for people, it's in the muscles in the lumbar area, along with an IV is the back protocol, okay? And I'm gonna get into a little bit more detail on that.
You spoke first about maintaining the viability of the product.
Correct.
When transferring to your facilities. How do you maintain the viability when bringing it to your client's home?
Good question. So once the tissue is processed, put in the vials, it's cryogenically frozen. Just, you guys all heard of in vitro, right? Right? Woman wants to have kids maybe down the road, so they get this egg and they cryogenically freeze it so that it stays viable until one day that they want to use it. So when these cells get shipped to the nurse practitioners in New Jersey, for instance, it's overnight shipped, dry ice, stays frozen the entire time until it's ready to be delivered. They hand warm the cells. And then you need to administer those cells within an hour, otherwise, yes, they will die. But once they enter your body, they're good.
So you said you guys wait for like a critical mass to be able to treat a lot at once. So do you kind of put your notice in and then you wait a little bit until there's enough people to treat that's profitable for you guys? Or?
No, we do these types of, like I said, dinners typically, 40 to 60 people. We'll treat 10 to 20 people out of that group. And some weeks maybe we only have 1 or 2, but typically we'll have 5 to 10.
Yeah, okay.
But if it's just one, we're still going to send somebody out to do that. But yeah. Okay, so we're going to keep going on. The second part of our white glove service. You guys all heard of Costco? How does Costco make a lot of their money? It's not the hot dogs, it's the memberships. That's right. Memberships. Before you can step into Costco, you got to have your membership card, right? $65 to $100, whatever. They have millions of customers that pay for this membership card so that they can go get the big bag of potato chips for a couple of bucks at Costco, right? You go to the local gas station here, you get the little one for like 5 or 6, right? Volume at a discount. So we don't sell memberships, but we are by far the biggest purchaser of stem cells from our lab. We get a big discount for that. We pass that savings on to our patients as well. So that's how we are able to keep it as affordable as we can, and that's basically the white glove service portion of what we do.
So, question, you just said you're the biggest purchaser of stem cells from your lab. Does your lab sell to other stem cell providers as well?
Yeah, they don't just sell to us. They're a business and they provide cells to many other clinics across the country. We do own part of the lab, however, yeah. So this is the most important slide so far that you've seen. Stem cells help hundreds and hundreds of different conditions. These are the ones with the highest success rate, and quite frankly, these are the most common conditions, especially for people as we get older, right? And we'll get into why that is. But you can see on the left there, those fall into a few different buckets, basically joint degeneration, arthritis, and inflammation. It's where stem cells really, really shine. So arthritis, joint pain, inflammation, osteoarthritis, TMJ, spinal pain. You guys all heard of degenerative disc disease, right? The discs in between your vertebrae, they're soft tissue. Bulging discs, slip disc, crushed disc, herniated disc. Stem cells repair those discs, okay? You guys heard of sciatica or stenosis? If you've had either one, it's pretty painful, right? Stem cells help to repair sciatica, stenosis as well. So degenerative joint disease, that's soft tissue defects in your joints. Cartilage, meniscus, torn ligaments and tendons, muscle injuries, strengthens our bones, okay? Rebuilds and repairs our blood vessels, which is blood flow is very crucial and critical when it comes to regenerating tissue, and also helps to repair damaged nerves, okay? So that's soft tissue defects when we talk about joint degeneration. So hip pain, knee pain, plantar fasciitis, tendon ligament injuries, bursitis. And then over here on the right, a lot of people have autoimmune conditions all throughout the body, systemic conditions, again, all throughout the body. So these are just a short list of the autoimmune conditions. Multiple sclerosis, rheumatoid arthritis, chronic fatigue syndrome, lupus, Hashimoto's, the list really does go on. I have a good friend in Utah. She's had ulcerative colitis for 12 years. How do you think her doctor treated her ulcerative colitis? Lots of steroids. Lots of steroids. Steroids are not good for us, right? They don't, and do you think that that actually helped solve the ulcerative colitis? No, it's really kind of just hasn't worked very well for her, to be frank, but it would give her a little bit of relief for a certain period of time until it didn't. And then what would they do? They'd bump up to something a little bit more powerful. You can only do that so many times. You kind of run out of options. And then down the road, she's looking at a colonoscopy bag at some point. Okay, so she had been going to her doctor for 12 years, had not been getting better. It actually had been getting worse. She'd really tried everything she could on the wheel of healthcare and really was kind of out of options. And so when she came to me, she wasn't really sure that this would work or what was an option, but she was willing to try just about anything to see if it would help. Well, we set her up with a 3-monthly IV protocol, 30 days in between. And it just so happened that after her third IV session, a couple days after, she had a normal, regularly scheduled colonoscopy to see where her blood levels were, her inflammation levels were. And the first thing the doctor said after she's waiting in the room to get the results, the doctor comes in, and the first thing her doctor says is, "Tell me more about these stem cells, what you're doing with these stem cells." Her inflammation levels over the last 12 years had been as high as 1,400, which is crazy high. And not to mention all the side effects from the steroids that she'd been giving her. The doctor came in, her inflammation levels were at a 13, which meant her ulcerative colitis is now in remission. 12 years, regular healthcare system, no end in sight. 3 months after these IV treatments, her ulcerative colitis is in remission. To say the least, she's very grateful and thankful to us and our company for what we've been able to. So it's just some of the possible benefits for people, and those are just one of many stories that we have of how the impact that we've made on them and getting their life back, getting their quality of life back through umbilical cord stem cells. So heart disease, I'll share a powerful study that was done a couple years ago for heart disease, COPD, long-term COVID, neuropathy, fibromyalgia, Parkinson's, and Lyme's disease. So let's talk about these stem cells real quick. Simplest level, how and why these work so well for people. So on average, about what age do most people start to have aches and pains, arthritis, inflammation, joint degeneration, on average? 40? Say generally, yes, can it be 40? 40 to 50, 50 to 60? Is that fair? Yep. If an 8-year-old breaks their ankle on the playground, they get casted up. On average, how quickly do they heal and get out of the cast back on the playground? On average? 6 weeks? Yep, pretty fair. If one of us in this room broke our ankle, how quickly would we heal and be back on the playground?
Just take the leg at that point.
12 weeks? Yeah, maybe for some of us that are in our 40s, but as we get older, what could it be? If it heals fully at all. But let's say 6 months, let's even say 4 months, okay? 4 months is, I'm gonna do my math, 16 weeks. 6 weeks for an 8-year-old, 16 weeks for one of us. Why is there such a big difference? Essentially, yeah. You never have more young, healthy stem cells than when you're first born. What heals your ankle and what heals your body are stem cells. So the stem cell, you break a bone, you damage the muscle, you probably damage the cartilage and meniscus if it's an ankle. You damage the blood vessels, right? All of that is repaired by stem cells, okay? As we get older, when a baby is born, they're born with about 220 differentiated cells. That means a differentiated cell means it's got one job, to create your nails, your skin, your eyebrows, your hair, right? 220 differentiated cells. We're all born with one undifferentiated cell, which is a stem cell. The stem cell is the only cell in our bodies that has the ability to turn into different types of cells, depending on what your body needs to repair itself. But once it goes from undifferentiated to differentiated, it's no longer a stem cell. That's why the number of stem cells in your body goes down. That also kind of makes sense why around 50 to 60, we start to have aches and pains, arthritis, inflammation, joint degeneration, because you no longer have enough stem cells in your body to keep up with your body's repair. So that means for the first 50 to 60 years, you had enough young, healthy stem cells in your body, and that's why you didn't have all these issues. So you guys all drove a vehicle here, or did you guys run here? Vehicle? All right, the vehicle you came here in was 40 years old, and you never changed the oil in your vehicle, how well would it run? It would not run. It would not move out of the garage, right? Okay, so all we're doing in an analogy is giving your body an oil change with millions of day zero stem cells to do the repair that those stem cells had been doing for you the first 50 to 60 years of your life. That's as simple and an explanation on how and why these stem cells help you get out of pain, okay? They're not synthetic, they're not made in a lab, it's not a drug. These were created by God in our bodies to heal and repair our bodies. And the reason at a certain point in your life that they don't work as well is because number one, how old are the stem cells that you have in your body right now? They're as old as you are. And they're kind of the ones you have left, depending on how much wear and tear you've done to your body, you know, how many bones you might have broken, how sick you've been, right? Just like all the other cells in your body, they don't work as well. Like, I don't perform as well as I did when I was 20. I like to think that I do, but I don't, right? So there's something called stem cell exhaustion. Your stem cells get exhausted, the ones that you still have left. They just don't work as well as they did before. So when you get an oil change with millions of day zero stem cells, that's why there's such a great traumatic response for people. Does that make sense? Okay, there's two ways that we treat, okay? IV, and it's not like one of those big drip bags, it's a push IV. So it takes about 3 to 4 minutes to administer. Kyle had an IV. And it's a push IV. It goes into your bloodstream. Your body sends those stem cells wherever they're needed the most, okay? The other way is if you have joint degeneration, imagine that any one of your joints in your body is the size of a baseball. When the injection goes in, the reason it works so well for local joints is because all of our joints are encapsulated. There's a joint cavity, which keeps the majority of those stem cells in that joint where the degeneration is, where you need it the most. So if I have bone on bone in the right knee like my grandmother, I don't want to do an IV because my body might think that they need to go somewhere else, more important. If I want to address the joint degeneration in my knee, we're going to do a local injection to the knee. Those cells will stay there anywhere between 6 weeks and 12 months, right, to get that repair. The inflammation will leave that joint rather quickly. Oftentimes, if you have bone on bone, you have arthritis and inflammation along with that. The arthritis and inflammation will be eliminated on average between 4 and 6 weeks. So that happens pretty quickly, which reduces a lot of the pain that people are in. And then just being patient to allow the regeneration process, which can take a little bit longer, up to 12 months. So we all had not all of us, but some of us had an invasive major surgery before. Yep. Average recovery time anywhere between 6 and 12 months. You guys agree with that? Depending on what it is. Before you go into the operating room, your doctor gives you a prescription for something. What is it? What? Painkiller. Yeah, painkillers. They know your body's going to go through trauma. It's getting cut open. You're going to be in pain. Okay? You don't just hop off the operating table and go back to your life, right? There's some lay down. There's rehab. There's physical therapy. There's recovery. It's not a fun process, and it's not a quick process, okay? So again, if you can keep your body part, which stem cell therapy allows a lot of people to avoid replacements and keep their own body parts, obviously we all would prefer to be able to do that, okay? All right, so I like to share this slide. We don't focus in on patients that have been paralyzed, but this is just to show you the powerful effects that stem cell therapy has. Like I said, hundreds and hundreds of other conditions outside of these that we focus in on. But this was the first gentleman, actually in Bowling Green, Kentucky. He was in a bad car accident, and he was the first US man to be paralyzed, receive stem cells, and get upper body movement back. Imagine being paralyzed and receiving any percentage of movement back after that. Pretty incredible. What? I have no idea. I'd have to look it up. But he's not the only one. There's many people across the world that have received stem cells after being paralyzed and gotten not necessarily 100%, but 10, 20, 30, I've heard as high as 50% movement back after stem cell therapy.
Would you consider doing a procedure for a senior citizen? As you said, as we get older, the stem cells aren't there. Just prophylactically?
What does that mean?
Just
remember, I'm not a doctor, and I used to be a kickball teacher.
There's nothing going on.
So a wellness IV.
I want it just in case.
Yes, that's the reason I will get a wellness IV every single year for the rest of my life.
Okay. So
because let's say you had something horrible like cancer, but you don't know you have cancer until you go to the doctor and they diagnose you. Well, you probably had some stage of that cancer for a while before that. So our bodies could have lots of other things going on that you're not aware of. Stem cells are amazing to help repair our bodies, get our immune system back in order. And so a wellness IV is preventative. Yeah, so you guys have all taken vitamins and supplements before? Why do we take vitamins and supplements? Same reason, right? Yeah, so wellness IV, a high percentage of our patients, they might have a knee issue, but they also want the wellness just for whatever else might be going on for them in their bodies. Yep, good question. Okay, I'm gonna poll the room really quick. Anyone have any back pain in here? All right, pretty common. How about neck or shoulder pain? Okay. You want hands or fingers? Usually arthritis. How about knee pain or leg pain? Knee or hip? Very common, very common. Foot pain or neuropathy? No? Good. Anyone's pain sitting next to them? Kyle, do not answer this. No. With my grandmother, I wasn't the one in physical pain, she was. But it affects everyone around them, right? If you love and care about somebody and they're in pain, it never feels good to see them go through that pain. And so that's what really helped me to realize that the physical pain of the individual isn't just their pain, it's others around them. How about trouble sleeping? Anyone trouble sleeping or maybe not feeling as rested as you've gotten older? Right? What's the purpose of sleep? Regeneration. Get your body back to its baseline. Yeah. So stem cells help to modulate our immune system, which helps better quality of sleep, feeling more energized, right? Or sometimes, as we get older, like I said, around 50, 60, we start to have a lot of aches and pains, which also interrupts our sleep because we're sleeping on a shoulder that hurts. Now your quality of sleep goes way down, right? Anyone had a knee or a hip replacement? Not in here, that's good. Anyone not as flexible as you used to be? All right, yeah, me neither. Okay, so what is pain? How do we handle it? What is one word to describe your pain or how it feels, how your pain feels? Okay, come around to just a few people. One word to, because everybody's pain is different depending on what's going on. Uncomfortable. Electrical. Pounding. Discouraging. You got any pain? Frustrating. Absolutely. So let's say, we'll use this. I usually use a salt shaker. Let's pretend my clicker has a stem cell genie in it, okay? And if I were to rub my clicker, stem cell genie were to pop out today, and you got treated today and were pain-free today, which is not how it works, right? We talked about this. Well, let's say it did. What would be one word to describe how it would be to be pain-free? Again, like the last time you can remember being pain-free, however long ago that was for you. So just one word to describe how that would feel. Yeah?
I kind of go into pain, but happy.
Happy, yeah, absolutely. Relief. Miracle, yeah. All right, we'll talk about that. Revitalizing, yeah. It would feel pretty good, right? To know that you're pain-free again. So some people will often say miraculous or a miracle. So this is just short of a miracle. Remember, we were all born with stem cells to heal and repair our bodies. I mean, it's a miracle that two people come together and one comes out, right? That to me is a miracle. But God created us with these stem cells to heal and regenerate our bodies. That's what heals our bodies. So it's not a miracle. Again, this isn't a drug. This isn't synthetic. This isn't made in a lab. These cells come from our body, and their whole purpose is to heal and keep us healthy. So this is how we describe pain. Some signal to our brain that something is wrong, broken, or not working correctly. So it's essentially pain is like a check engine light for our bodies. If you ignore the check engine light in your body for too long, like things are going to get worse, right? So this here is the most important slide, I feel. So again, these are the main functions of stem cells. And we've talked about some of these already, but inflammation, eliminating inflammation, typically on average about 4 to 6 weeks, these stem cells will eliminate the inflammation in your body. Inflammation acts like a magnet for stem cells in your body, okay? Anytime you have inflammation, chemical signals are being sent out into your body for stem cells to go get rid of that. The problem is, as we get older, we don't have enough young, healthy stem cells left to keep up with that, okay? Modulate the immune system. Who remembers, I don't even know, 15, 20 years ago, does anyone remember having to defrag your computer? You guys remember that? Why did you defrag your computer? What was going on with your computer? Slow. It was running slow and sluggish. So you defrag it, and it took a long time. It would kind of like reorganize the disks and the files in your computer so that it would run like it's supposed to. Stem cells act like a central computer system for your immune system to remodulate it and getting it to work like it's supposed to, okay? The other piece is stimulating regeneration. Again, takes up to 12 months, depends on the person, how old they are, many factors, how good their quality of sleep is, how well they're able to move, because movement is good for these cells, like the quality of food that they eat, are they getting enough water, right? There's a lot of variables that's gonna determine how quickly you get that regeneration. But that's the cartilage, the meniscus, the muscle, the tendons, the ligaments, the bone, repairing the damaged nerves, rebuilding and repairing our blood vessels. And then scar tissue. No one in here has had a replaced joint, which is good. But there are a lot of people that come to us that have had a replaced joint already, but they still have pain in that joint. The pain is not coming from the artificial joint. It's artificial, it's man-made. That's not sending the signal to your brain, so what could the pain be from? I'm kind of giving like the answer to the test right here. The scar tissue or arthritis and inflammation. Yep. So those are the 4 main functions on how stem cells help to repair and regenerate our bodies and get us out of pain. All right, so let's talk about, remember, this is the glide path to surgery in the US, in our healthcare system. The first step is pills and shots. Anyone ever had a shot for pain? Yeah, Jack Daniels or tequila, which one? Cortisone, right? Is cortisone good for your body? No, why? What does it do? It degenerates the tissue, which sounds pretty ridiculous because the tissue is already degenerative, right? So if you know you have bone on bone in a knee and you need a replacement, you know your knee's bad enough where you probably need a replacement. You go to the doctor for the first time to address that knee. The doctor knows that you should get a replaced joint. Will they just take you to the surgery room? No, there are certain steps or protocols our doctors have to follow in our healthcare. They work for a hospital and they have to follow the protocols. They also have to answer to the insurance companies. Insurance companies aren't just going to approve you for a surgery, right, before they take you through certain steps. They're going to give you pain pills, probably some physical therapy, shots, right? So they give you the shot, the cortisone. We just said that it doesn't solve the problem. It actually makes the problem worse, faster, so that you can then get what? Surgery. The problem is already degenerative. They give you cortisone, which makes it worse faster, so now you can get approved for surgery by the insurance companies. That's the answer in our current healthcare system. You have a replaced joint. Let's say it's a hip or a knee. You now have a new body part in your body. What does that do to the way you walk? It changes the way you walk. If you start walking differently than you have your entire life, what does that do to your other joints? Causes more stress and pressure on those joints, which creates more problems. Now we got to come back up here, right? Wheel of healthcare, just like the hamster and the hamster wheel doesn't go anywhere. You come back up to step 1, and again, they're not just going to send you to the surgery room. They've got to take you through the pills, the rehab, the shots before you get the surgery. Once you get on the wheel of healthcare, it's really hard to get off because they're not addressing the root cause of the problem. Let's talk about pain pills. Do you think Big Pharma is a fan of regenerative therapy? No, not at all. Remember what we said, you run out of pain pills, you don't stop taking them, you refill it. That's a pretty good business model, right? So here's a few stats for us. This is a map of the US. The US makes up about 5% of the world's population. What percentage of pain pill usage does the US make up worldwide?
30.
80, 30, 90? 82%. 5% of the world's population uses 82% of the world's pain pills. That's 8 out of every 10 prescriptions worldwide for pain pills is here in the US. That's how deep the hooks of Big Pharma is into our healthcare system and our insurance companies. We all agreed at the very beginning that pain pills don't solve a problem, and they actually have some pretty bad possible side effects, yet we use 82% of them in the world. Crazy, right? You guys heard of Pfizer? How long has Pfizer been in business? Guess. This is like Price is Right. 110, 176 years. I think it's actually a little bit more than that now. 176 years. How many diseases has Pfizer cured? 0. A patient cured is a customer lost to Big Pharma. FDA, Food and Drug Administration, that's the organization in the US that determines what types of treatments are available or not available to you in our healthcare system. Big Pharma provides 75% of their annual budget every year. Do you think Big Pharma has influence on what they allow and don't allow in our healthcare system? Yes, absolutely, 1,000%. Drug firms paying our doctors. There's literally a couple movies on Netflix on this topic alone. $74 million in kickbacks from Big Pharma to doctors and hospitals to write their prescription over a different company's. Not in the best interest of the patient, but who's paying the bigger kickback? 74 million in one state in 1 year. That's a lot of prescriptions written, again, to not solve a problem. Okay, this is a short video. Many of you probably recognize Joe Rogan. He's a big proponent of stem cells. He's a podcaster, UFC commentator, comedian. He's going to talk about 2 different stem cell products, exosomes and Wharton's jelly. Those are 2 products that we provide for our patients as well, but this is Joe Rogan.
Bunch of stem cells shot into my shoulder that healed it up. But I had some pretty significant shoulder injuries.
Yeah. You did the labor room surgery? You rotator cuff?
No surgery, but I had a full-length rotator cuff tear.
Okay.
And they used exosomes, and it was gone. The next MRI I have, the tear was gone.
Yeah.
It goes, it just seals up. And I went through the rehab, and then I got another MRI like 6 months later, 8 months later, whatever it was. When it started feeling good, they said, well, let's take a look at it. And they were like, holy. Like Dr. Roddy McGee from Vegas, who does a lot of the UFC stuff, he goes, do you know how crazy that is? He's like, your tear is gone. It doesn't exist anymore. There's new stuff now called Wharton's jelly that is even more powerful than any of the previous stem cell ones, and I had that shot into my shoulder too.
And that's all in the States?
All in the States, yeah. Because stuff in the States now is way more potent than it was just 5 years ago.
Okay.
Because I heard way more. They do IV stem cells too.
Yeah. So let me ask you. So what exactly does it help? Does it help with like
regenerate soft tissue?
So like, would that be like a tendon, a ligament?
Tendons, ligaments, muscle injuries, things along those lines. They can regenerate ligaments, regenerate tissue, tears. You know, like stuff where you ordinarily would have to get things sewn up.
Okay, so that's Joe Rogan. Again, so regenerative medicine, it's the science and study of how to help the body heal itself non-surgically, non-steroidal. The goal and purpose is to regenerate and repair damaged tissue, address the root cause, and correct it so it doesn't come back. That's why so many people come to us as Neoform Wellness. We treated over 900 patients just last year. 25 years ago, this type of therapy absolutely should have been available. It wasn't until 2016. Again, Big Pharma, our government, kept it out as long as they could. What instead did Big Pharma introduce to our healthcare system around 25 years ago? Any guesses? You guys ever heard of oxycodone? Killed over 500 million people in the last 25 plus years. Did Big Pharma know it was killing that many people? What do you think? Yep. Did they pull it off the shelf? No, they put more money into marketing and advertising it to us as patients. They really don't care about our health. All they care about is their pockets, okay? There are a lot of hospitals and clinics that saw the powerful benefits 25 years ago, put a lot of money into research like Cedars-Sinai for skeletal regeneration. This blows my mind still to this day. Has anyone heard of this before? Scientists successfully grow a full-size beating heart using stem cells in a lab. Almost no one has ever heard of this. If we can do this, but you've never heard of it, right? This should be in the front page of the news, in my opinion. What else, what other technology do they know about that could really help us get off the wheel of healthcare that's not available to us because of money? Cleveland Clinic has led the way for stem cell therapy on heart disease. This is a study I mentioned earlier. Texas Heart Institute, this was a couple years ago. One single injection of stem cells slashes the risk of heart attack or stroke by 58%. It actually slashes it by up to 75% with people with higher levels of inflammation. If you think about it, if you have high levels of inflammation, you're more of a risk for heart attack and stroke. Johns Hopkins, again, that's where Haven McCall, the owner of our lab, that processes all our tissues, a lecturer. They're the ones that led the way on the joint protocols, realizing because it is encapsulated, the majority of those cells will stay there. So that's why you want the local injection when you have a specific joint that is degenerative. Okay, for years prior to 2016, celebrities and athletes, people with the resources to go overseas, were using stem cell therapy for a long time. Here's a few notable athletes like Tiger Woods, Peyton Manning, Jack Nicklaus. You guys all heard of Peyton Manning, right? If you didn't know him as a football player, you probably know him as a funny guy on TV, right? So he played for the Colts for 14 seasons, Indianapolis Colts. His 14th season, he didn't play. He had 4 failed neck surgeries in 19 months. Do NFL teams have good doctors? They have the best because they pay their players millions of dollars to actually be on the field, be healthy and on the field. Do you know what the Colts did to Peyton Manning? Well, no. What did they do?
Oh, they got rid
They released Peyton Manning, one of the best quarterbacks ever, because he had 4 failed neck surgeries in 19 months. They didn't think he would play again. He got cut, went to Germany in 2010, I believe, for stem cell therapy. Did he play again? Played 4 more years for the Broncos after being cut by the Colts because they didn't think he'd play again because of stem cell therapy. They went to 2 Super Bowls with the Broncos. They won one of them, and he was NFL MVP. He threw like 55 touchdowns one of those years. Yeah. All due to stem cell therapy. So this is a short little video on his powerful testimony with stem cell therapy.
Peyton Manning shaken up, losing his helmet.
Manning has had 4 medical procedures in just 19 months, rendering his neck almost bionic.
That the Indianapolis Colts will release quarterback Peyton Manning.
Peyton Manning was cut by the Colts because of concern about his health.
The wait is over. Peyton Manning has made his decision. He will continue his career this upcoming season with the Denver Broncos.
Powerful story. All right, so this is the next video. This is a short video on what are stem cells, where they come from, what their main functions are.
Are the master cells of the body, the building blocks of tissues and organs. The umbilical cord and the blood left in it at birth contain a broad diversity of pristine newborn stem cells that have demonstrated the ability to help other tissues and organs heal themselves after injury or disease. While researchers have yet to identify every type of newborn stem cell, they have isolated specific stem cells that are the building blocks for other cells and organ tissue throughout the body. Mesenchymal stem cells, found primarily in the umbilical cord tissue itself, have the ability to help form bone or connective tissues like cartilage and ligaments. Stem cells from the umbilical cord and cord blood have distinct benefits compared to adult stem cells from bone marrow. They're younger, have greater ability to multiply, and have had minimal exposure to environmental factors like viruses or chemicals that can interfere with cell structure and function. Researchers theorize that this diverse population of cells functions like a symphony, each type of cell having a different role to perform in healing damaged tissue and cells. Current research suggests that newborn stem cells help orchestrate a natural repair process by helping to reduce inflammation, stimulate the growth of blood vessels, improve blood flow to injured areas, and ultimately enabling injured cells to repair themselves.
Okay, so let's talk about the umbilical cord tissue real quick. That's just a map showing you how close the hospital is to our lab in Utah. Again, we get our tissue processed within 3 hours versus the industry average is anywhere between 1 and 3 days. That's a big part of the reason our tissue is so viable. Donated by live healthy births. If this tissue isn't donated, it actually becomes biologic waste. They throw it away, okay? So the mothers and the cords are screened vigorously, right? The mothers are screened and tested for infectious disease, sterility, endotoxins, before delivery, and then actually again after, along with the tissue, okay? So top 2 to 3% of that tissue passes these vigorous tests to be used. So you're getting the best of the cells. The reason we're able to receive someone else's tissue, right, from a donor, from an umbilical cord, is because the technical term, there's no HLA or human leukocyte antigens. See, it's even hard for me to say, but the most simplest way to explain this, these cells haven't gone far enough in the gestation process from the mother to the baby, right? They're still in the umbilical cord. They haven't gotten to the baby yet. So there's no HLA, there's essentially no DNA markers passed on from the mother to the baby, still in the umbilical cord. So that's why we're able to receive these and not reject them, which is the most important part, right? Okay, this is a great visual to show you how quickly the number of stem cells over time goes down in our bodies as they get used up. A newborn, we all have trillions of cells in our bodies. A newborn has 1 stem cell for every 10,000 cells. Come out here to age 30, it goes from 1 every 10,000 to 1 every 250,000. You come out here to over the age of 60, 1 every 10 million versus 1 every 10,000. That's why around 50 to 60, we start to have all these problems. You don't any longer have enough stem cells in your body to keep up with its repair. The other thing our stem cells do is they proliferate, or they divide and multiply in your body from the day you're born. A newborn stem cell will proliferate every 24 hours. So if you double $1 every day for 30 days, you'll have $1 billion. If you take 1 newborn stem cell in a dish in a lab, it'll proliferate every 24 hours. After 30 days, you would have 1 billion cells. You come out here to age 60 and over, the proliferation rate slows down to 1 every 60 hours. After 30 days, 1 turns into 200, not 1 billion. Well, when you receive these day 0 stem cells in your body, they reprogram the current stem cells you still have left to proliferate more like they did when they were younger. It speeds up the proliferation rate of those. So it reprograms your stem cells to act more like younger stem cells again. So this next slide is one of the last videos we have. It's with Dr. Neil Reardon. In the early 90s, when stem cell therapy was realized for its powerful benefits, Big Pharma kept it out as long as they could. A lot of doctors went overseas to open clinics. Dr. Reardon opened one in Panama. It's still, to this day, the #1 most visited stem cell therapy clinic. He's written a few books on stem cell therapy. He's got like 13 patents on stem cell therapy and research. So this is Dr. Neil Reardon.
Cord's cut, baby's taken away. And then some short time thereafter, mother delivers the afterbirth, which includes the placenta and the umbilical cord and the amnion. And all of that tissue is rich in cells. And these cells are basically biologic garbage, and they're thrown away. So what we do is we take that tissue. You've reset the clock. These are day 0 cells from a baby that was just born. They have a high degree of ability to reproduce and to secrete the things. The 3 major things that we know that they do in the body, they secrete a batch of molecules that stimulate regeneration, that decrease inflammation, and modulate the immune system. So their main job in the body is to maintain the status quo. So when you're sick, you're not maintaining the status quo. When you're 70, you're not maintaining the status quo. Look at yourself, look at a picture of you 10 years ago or 20 years ago. You haven't maintained the status quo. Things are going south. And so these cells, their job is to maintain the status quo. And that's why I think they're so important for aging research and for chronic illness.
What stem cells do can seem little short of miraculous.
What I do myself and what I think is going to be ultimately the answer for a lot of age-related decline and age-related chronic diseases is taking young, healthy stem cells, for example, from umbilical cord, and using those to supplement what you have. Because not only do they do the job of the stem cells that you used to have, but they also stimulate what you have left to behave younger. So they are the reason you renew yourself. And one question I get quite often is, how can these stem cells treat so many conditions? And the simple answer to that is the root cause of most of those conditions is lack of stem cells. Either lack of stem cells or the ones you have left aren't working properly. So if the common cause is that, then it would make sense that the treatment of choice would be replacement of those stem cells with ones that are healthy and ones that are active.
There are 2 main kinds of stem cells. Neil uses mesenchymal stem cells, MSCs.
These MSCs are found throughout your body, so you can get them from the fat, you can get them from the bone marrow. Every organ has MSCs in it. And if you have a tooth taken out, you can take MSCs from that. But the problem with those MSCs is that they're as old as you are. and a lot of our patients are advanced age. If you're young and healthy, your MSCs are in great shape, right? But the sicker somebody is and the older they are, they have what we would consider an MSC exhaustion condition. So the young cells, when they're in contact with the old MSCs, they actually reprogram the old MSCs to act more like young MSCs. So their turnover time is quicker. So just to give you an example, if you take MSCs from a newborn, they'll divide about every 24 hours. So you start with one cell, and you let them divide in the laboratory for 30 days, you'll have 1 billion cells. So you take the same cell from a 35-year-old, and it divides around every 48 hours, right? And that sounds linear, you know, from 24 to 48, but at the end of a month, you have 32,000 cells instead of 1 billion. And if you take from a 65-year-old, the average doubling time is 60 hours. And you do the math on that, at the end of the month you have 200 cells. Well, if the repair that's required requires 1,000 cells or 5,000 cells or 10,000 cells, you're always going to lose, right, if you're in that condition. So that's why at later ages, people have such a dramatic response, is because they're always deficient on the repair side. And these cells help their cells behave younger and basically do more repair.
Okay, so that's Dr. Reardon, the same guy we just saw. These are 2 of his books. Who said they had trouble sleeping or not feeling as rested? Okay, I got a quick fix for you. You pick up that first book, 3 minutes after you start reading, I guarantee you'll fall asleep. That's a tough book. This one's a little bit more enjoyable, easy to read, but that's Dr. Reardon. Okay, who knows what would we call this? Bone on bone. It's a knee. Can you see how cloudy it is? What's that cloudiness? Inflammation or arthritis, correct. It's pretty severe, bone on bone. You can see there is a little cartilage there. What do you think the doctor was telling Janice? Janice was 73 when she got treated. Replacement. You come over here, can you see how clear it is? The inflammation, arthritis is gone. Can you see that gray tissue in between the bones now? What is that? That's new cartilage that has been regrown and regenerated. Okay, can you see that red arrow? It's pointing to a bulge in the disc. It was created by a failed laminectomy. Doctors are human, they make mistakes, created a bulge in the disc. Okay, stem cells help to repair our discs. You can see over here, there's 24 months in between, and this is to show you that this is not a temporary solution, right? One-time treatment, allow time for that tissue to regenerate, but once your tissue regenerates, it's new tissue. You don't need to keep coming back for multiple treatments month after month or every 6 months. Okay, remember how I talked about blood vessels as we get older, they get weaker and they die off. You can see here, prior to stem cell therapy, you can see after, that's 6 months after, you can see how much more full and robust those blood vessels are from the stem cell therapy. Blood flow is key. It brings blood, it brings oxygen to the areas where the deteriorated tissue is. You need that to help regrow and regenerate. Anyone with neuropathy in here? All right, well, stem cells help to repair our damaged nerves. That's the main cause of neuropathy for people. Lack of blood flow, lack of oxygen, your nerves start to damage and die off. You can see over here, 14 weeks after, how the nerve activity has come back. The blood flow comes back, the oxygen comes back, the nerves are repaired. And then you can see the still photos over there. See on the left how black and blue those feet are, the tissue's dying off on the feet. And then after, how they've come back to life. Pulmonary fibrosis gets rid of scar tissue in our lungs. You can see on the right, after stem cell therapy, the scar tissue is gone and the lungs have actually grown in capacity. That's a peripheral benefit that many people will say they feel like they have increased lung capacity, because stem cells help to repair our lungs. Okay, this is a short video. This guy's name is Ken. He talks about some of the peripheral benefits he received from his back treatment. Again, our back is not a joint, right? So that's why we give the IV as well, because it goes into the muscle along the spine. Those cells technically are not encapsulated. They could go to other areas if your body feels like they're needed somewhere else. So that's why we do the IV. So the IV will send cells to wherever your body might need them so that those cells in the back will stay there to repair that damaged tissue. So he's going to talk about peripheral benefits. Again, a peripheral benefit would be a benefit we received that wasn't the primary reason you got the cells. So he shows a great visual to kind of show you how he noticed quickly the powerful benefits for stem cell therapy.
Alan, I'm from Spokane, Washington, and I want to share my stem cell therapy story. So when I was younger, in my teenage years, I remember my parents complaining about back pain, thinking that seemed crazy to me. I just didn't understand what could hurt in your back. And then by the time I was in my early 20s, I understood what they were talking about. I started to have back pain at a very young age. And by the time I was about 26 years old, I was having back pain, and I would rate it about an 8 out of 10 on a pain scale. And I've always had a personality to use natural remedies, and so I found some natural things to help me reduce that pain level. But the older I get, I've recently turned 50, those things don't tend to get better, they tend to get worse with age. And so when I was introduced to the thought of having stem cell therapy, very excited about that opportunity. And so coincidentally, right before I was ready to go in to have my stem cell therapy, I love the outdoors, I love to backpack. I had been on a pretty extensive backpacking trip, and I sprained my ankle pretty severely. As a matter of fact, here's a picture of what my ankle looked like 24 hours before I went in to have my stem cell therapy.
So he sprained his ankle 24 hours prior.
And then if you look at this next picture, this is 24 hours after having stem cell therapy. This is the exact same ankle.
Swelling's gone.
So again, that wasn't the reason that I went in to have stem cell therapy. That just happened to be coincidental. But it was such visual proof so quickly of how amazing the results can be from stem cell therapy. But again, the reason that I went in was for the chronic pain in my back. And the reduction of pain has been incredible. I've always said my entire adult life that if I didn't have back pain, I'd be a different person. And I can tell you that I'm a different person. Even standing in the shower, just having the water hit right between my shoulder blades, I would get a burning sensation because of the pain in my back. And that has pretty much gone away. The sensation is so minimal, I hardly even notice it. And the systemic effect that it's had on my body is pretty incredible as well. I actually, about a year and a half ago, had a chronic sty on my lower eyelid that the doctors were actually recommending surgery because it had caused such an abrasive effect inside my eyelid. It has healed that. That has completely gone away. Just the natural aging process. I've had some little bumps appear on my face over time. Those have begun to dissolve and go away. And then another great byproduct is that the inflammation in my prostate, again turning 50 years of age, that can become a problem, has made it so that I don't feel the urge to have to get up in the middle of the night to use the bathroom as well. So getting those kind of results myself makes me very excited to share this opportunity with other people because I think that most people out there can benefit from stem cell therapy.
Okay, this is just one more example of bone on bone. Again, this is 93 days in between, but you can see the inflammation and arthritis. This is a little more severe case of bone on bone. And then again, you can see how that inflammation and arthritis is cleared up and that regeneration of that tissue. Okay, so we're gonna get this kind of towards the end here. Most frequently asked questions. How long will it take to feel better? Again, anywhere between 4 to 6 weeks for the elimination of inflammation and the remodulation of the immune system. And then anywhere between 6 weeks and 12 months for the regeneration of that tissue. And again, it varies patient to patient depending on a lot of the different variables I talked about earlier. Can you receive multiple treatments in different body parts in one visit? Just like Kyle had 4 different areas that we treated. The typical, most common is about 1 to 3 areas. I'll come to you in a second. 1 to 3 areas on average per patient, okay? Is this covered by insurance? No. This is why I think it's a great thing. So, 3 parties that determine if you can have surgery are who? Insurance company, doctor, and us, right? Out of those 3 parties, who has your best interest in mind? You do. Out of those 3 parties, who has the final determining decision maker on whether you're approved for surgery or not? Insurance, not you, right? You have to get permission from the insurance company. With stem cell therapy, the decision is completely yours. You don't need permission from the insurance company, okay? I have a good friend in New Jersey. He ran cross-country track for Penn State in college. He's 46, and his doctors told him he needs a knee replacement. Do you think the insurance company is going to approve him for a knee replacement right now? Not at 46. Why?
They'll say he's too young.
He's too young. On average, there's about an 80% likelihood once you replace one joint, you'll replace that same joint in 10 to 12 years because it's a man-made part. It breaks down and it wears out. He's 46. He very well, if he lives a long life, have to get 3 or 4 different replacements on that same joint. Those are hundreds of thousands of dollars worth of surgeries per time. Yeah, he's too young. So we're trying to get him taken care of with some stem cell therapy. Okay, Medicare. People ask if it's covered by Medicare. MCM 2251.3, care that seeks, this is right from Medicare, care that seeks to prevent disease, promote health, and prolong and enhance the quality of life is not considered medically necessary, therefore not payable. You want to live longer, be healthier, have a better quality of life, that's not medically necessary, so they won't pay it. Yeah. You had a question, what was your question?
So after initial injection or IV, is there any activity restrictions for a period of time?
Yeah, there's a whole protocol that we go through with our patients, but to be honest, not a lot. Like when I got my knees done, I went back in my car and I went to work. I didn't go run 100 miles at that point. So yeah, but there is a specific protocol that we have people follow days and weeks after. Yeah, you don't want to do anything too strenuous, but you can go about your daily life. That's another great benefit to this. You go to the surgery room, you're not going back to your daily life, right? Okay, good question. How do we make it as affordable as we can? Again, we don't have big brick and mortar clinics. Again, when we're doing dinners, everybody's a part of the group pricing. We send one nurse practitioner and a 1 to 2 day time frame to help keep the costs down, and we get the big volume discount from our lab that we pass on to our patients. So for my grandmother, like I said, she loves to travel. She's not like super wealthy by any means, but she spent more money on other things in her life than she did this therapy. The therapy, the cost of it didn't change her life. The umbilical cord stem cells absolutely did. So this next slide is a range of where the majority of our patients fall into as far as price goes, okay? So, and I'm actually I didn't tell Kyle this, but typically there is overhead costs for our business, right? Like any business, we pay for mailers to get people to come to our dinners. We pay for the dinners, right? We didn't have any of this, and Kyle's a great friend. So if anyone is interested in this type of therapy with us, we'll give you a 30% discount off of our normal cost. But this is our normal cost here, anywhere between 4.5 to 18K. And again, it just depends on how many areas addressed, how many stem cells that would require. But I would say just about everyone falls into that window somewhere, okay? We do have financing discounts available for military, teacher, and government first responders. Are there any side effects? Obviously with surgery there is. With regenerative therapy, anytime we receive a shot or an injection, there could be redness or soreness. There's something else also called healing crisis. Healing crisis isn't bad, but whenever you get a large amount of stem cells in your body, it can cause a little discomfort for a few days because those cells are going to work to regenerate your body right away. They're also recruiting other cells to the area to do that. So we will never treat more than 5 areas in one visit. So let's say someone has 6 areas they're going to address, which isn't the norm. We would do 3 areas in the first visit, and then 30 days later, we'd come back and do the other 3 just to help avoid the healing crisis. Okay, so how many treatments do you need? Probably 96, 97% of our patients are for joint degeneration, arthritis, and inflammation. And that's one treatment. Once the regeneration happens, there's no need to get another treatment. Like you might down the road have another injury or issue that you want to address, but for that specific area, one treatment. For full systemic, that's again like autoimmune conditions like my friend with ulcerative colitis. She had it for 12 years. Her symptoms were pretty severe. That's why we decided to do 3 different treatments for her to really get her the results she was looking for. Last video, and then we're going to get in the very last steps here.
Hands. I have not played in this concert hall any solos in 10 years. And there's a reason for that, because I've been suffering with osteoarthritis in my thumbs. And in September, I had stem cell regenerative therapy done in my thumbs, and I can play again.
I think that's pretty cool. All right, Kyle, could you help me pass some of these out? This is just a survey. I'm going to go through what this is and what to do with it in just a second once everybody gets one. So if you came as a couple, you just get one. Both of you can put your info on here. If you came by yourself, you get 5 of these, all right? Just kidding, just one. No laughs on that one? Man. You guys laughed at my other jokes. Here you go.
Thank you.
You need a pen, let me know.
I need a pen, please. Thank you. Take a pen.
Yes. Hopefully I got enough pens. You got a pen?
I'm with that one. Yes, please.
You're with who?
That guy in front.
Do you trust
You
me
want?
to have the
There
right
you go.
information?
Thank you. Thank you. Right.
Thank you.
For his secretary. Thank you.
Okay, so eyes up here real quick. I know, just like in school, you get that test, you guys want to put your name on the top right away, right? Okay, so this is the next step in the white glove service, is a pre-screen to find out if you're a candidate, to find out what areas you're looking to address, to talk about what the timeline would be to get the results, how quickly you can get treated, answer any questions you have. That's all part of the pre-screen. Okay, normally we would be doing these in your home tomorrow. However, this is a little different, right? I'm kind of doing this for Kyle, but we can do, I might have availability to do a couple if someone's really, really interested. Otherwise, we could do this over Zoom as well, okay, in this instance. So if you're really interested in this type of therapy, like you're really interested, you like what you've heard, and you want to sit down to see if you'd be a candidate, we'll tell you exactly what it would cost, right? Because everybody's situation's a little bit different, right? So again, we'd talk about, are you a candidate? How many areas are you looking to address? How many stem cells that would be? What the cost would be, so that you have all the information to make the best decision for you. Typically, the treatment happens in about 3 to 4 weeks after this evening, okay? That's about how quick it happens. So there's no cost for this as a part of this seminar. And it takes about 15 to 20 minutes per person to do a pre-screen. So it really doesn't take that long, but I'll take as much time as you need to answer whatever questions you have and give you all the info. So on this pre-screen, if you are really interested, you'll see at the top, fill that out, very self-explanatory. The middle section, that just really gives me an idea of kind of where you're at, what's going on for you, okay? And then the bottom part, you can, if you would like a pre-screen tomorrow while I'm here, I can come to your home. If there's a couple of you, I could probably fit a few of those in tomorrow. Otherwise, again, we can call you and set up a time through Zoom to do this, okay? Because we got some things planned for tomorrow as well. But again, that's the purpose of the pre-screen, and to tell you exactly what it would cost and whether you'd be a candidate or not, okay? Part of the pre-screen is any prescription medications that you're taking, so that would be something that we would need available at the time that we meet, okay? So again, this is what that is. You can fill that out. If you have questions, if you're not filling it out, just give me the paper back, okay? If you have questions, I'm gonna be hanging around for a bit. I can answer those questions as, you know, if I could get my pens back, that would be awesome. I don't want to chase you down in the parking lot. I was working out in the parking lot at 5 a.m., so I will come outside for my pen.
I have a question. I noticed that it said that you rely on cesarean section births.
Yes.
So they can't use the umbilical cord from a live birth. Because the other thing that the U.S. is often known for, guilty of, is a high rate of cesarean births compared to other countries.
Yeah, more and more.
And yeah, it's very high, and a lot of women kind of feel like they get pushed in that direction. So is there a reason why it relies on that?
Yes. There's more chance of infection through a natural birthing canal. With the C-section, it's much more clean, and that's the main reason. So, yep.
Do you know if the mothers know that this is what's being done with the umbilical cord?
Remember, live donated healthy birthing tissue. The mothers voluntarily donate the tissue. They're tested before the delivery. So yes, they're 100% aware of it. Yep. Yeah, I mean, they literally get tested before they have the delivery. So yeah, there's definitely consent. It's like, have you ever been an organ donor? Like you had to consent to that, right? You know, obviously, well, you haven't donated the organs yet, but you're willing to.
What percentage is successful? Is there anyone that's not successful after receiving?
Yeah, I mean, is anything guaranteed in the medical world?
No.
If you have a surgery, is the doctor guaranteeing your surgery? No. So very high success rate for joint degeneration, arthritis, and inflammation. That's why it's around 90% or more. Again, it depends on severity of the person, quality of their diet, like how much wear and tear, but it's a very high success rate. We actually offer an 80% discount if you don't have at least 50% improvement after 12 months. Will your doctor ever give you 80% discount for a second treatment on a surgery if it doesn't work? No. We're able to give an 80% discount because we know that this works.